1. Excessive thirst and the need to urinate more often than normal. Feeling very thirsty and having to drink more than normal is a typical but not so obvious symptom of high blood sugar. Elevated urination, also known as polyuria, happens when the blood glucose levels rise, forcing your kidneys to work harder to eliminate the excess glucose. If your kidneys can't keep up and change blood sugar to a normal amount, the extra sugar is flushed out of your body by urine. You can become dehydrated and dizzy as a result of this. 2. You're hungrier than you've been, but you're losing weight. Numerous people with unregulated high blood sugar become hungrier than normal, a symptom known as polyphagia. Even though you're eating more, you could be losing weight for no obvious cause if your blood sugar levels are too high. Since your body can't get energy from the preferred source, glucose, it must rely on muscle and fat for energy. Unintentional and excessive weight loss occurs as the body begins to break down muscle and fat for energy. You can note muscle weakness and falling more frequently, in addition to these changes in weight and appetite. 3. You're always tired and fatigued. According to the American Diabetes Association, fatigue and excessive tiredness are signs of uncontrolled blood sugar. Sugar stays in our blood rather than going into our cells to be used for energy because our bodies do not absorb insulin properly or have insufficient quantities of insulin. Dehydration, which is another factor that contributes to fatigue, may also be caused by repeated urination. 4. You have a lot of headaches and your vision is blurry. You can note that your vision isn't as sharp as it once was, and that things seem hazy. Fluid leakage from high blood sugar levels can cause swollen lenses in your eyes. This alters the form of the lens, making it unable to focus properly and resulting in blurred vision. You may also be having trouble at work, having trouble driving, and getting regular headaches. 5. You get sores that take longer to heal than normal. Diseases, cuts, scrapes, bruises, and other wounds recover more slowly when blood sugar is out of balance. Diabetes damages nerves and impairs circulation, especially in the lower legs and feet, delaying healing because there isn't enough blood flow. Even minor wounds are more susceptible to infections, which can become very severe and result in foot amputations. If you develop a foot ulcer, you can find leakage seeping into your socks or an unpleasant odor. 6. You're experiencing tingling and numbness in your hands or feet. Diabetic neuropathy is a form of nerve damage caused by uncontrolled blood sugar. Your hands and feet may feel tingly or numb. Some may also suffer from pain in their hands and feet. Though neuropathy is more common in people with long-term diabetes, it may affect someone with poorly regulated diabetes. 7. You're getting blisters, dry skin, or other skin issues. Skin tags are small pieces of extra skin that develop in the creases of the skin, particularly if you have diabetes and are trying to lose weight. Acanthosis nigricans is a dark, thickened area of soft skin that may appear on the back of the neck, hands, armpits, ears, or other regions. Insulin resistance can be detected by these symptoms. Blisters, infections, dryness, itchiness, discoloration, and skin defects are also symptoms of high blood sugar. 8. You're suffering from yeast infections more often than ever. Hyperglycemia may increase the frequency of genital yeast infections. Candida albicans, a type of yeast, fungus, is frequently the culprit. Vaginal itching, redness, and soreness, pain during sexual intercourse, pain or irritation during urination, and dense, irregular vaginal discharge are all possible symptoms. Although yeast infections are normal in people without diabetes, having more glucose in your blood increases your chances of getting one. 9. Infection risk increased by swollen or bleeding gums. Gum disease is a complication of diabetes. Since the body's reaction to infection is to release further glucose into the bloodstream, it can make diabetes more difficult to manage. Your saliva contains glucose, and the more of it there is, the more bacteria there are to feed the bacteria in your mouth that combine with food to form plaque and cause gum disease. At first, red or inflamed gums may be present. If left untreated, they can lead to periodontitis, which causes your gums to pull away from your teeth, pus or ulcers to appear, and even tooth loss.